Anyway, I have a few notes here that I'm going to go through, but I thought I'd start by telling you a couple of stories because I was listening to the story of the Christmas cards, and of course that story emanates from one of the long-term care facilities that I'm responsible for, so you can appreciate every day when I went to work, the very first question I would get is, how many cards today? So I would call up to the nursing home and I would say, Gail, how are we doing for cards today? And she would say, it started off like we would get a few hundred, then you're getting 800, and you're getting 1,000. I think the last time I called up, she said, we got 2,500 today.
Wow.
I said, who is taking the time to count them to begin with? I'm going to tell you a little bit of a funny story about my own particular situation. My father had dementia and was in one of the nursing homes in Charlottetown here for a number of years. And I remember going to visit him one day, and I was fully grown. I won't tell you how old I was, but it wasn't that many years ago. But anyway, I went to see him, and my father had just finished having supper. And I was sitting there talking to him. It was one of these days that he recognized me, and he actually called me by name. And right after he came back from having supper, he said, Cecil, take me to supper. I said, Dad, you just had supper. He said, Cecil, take me to supper. And I said, Dad, you just had supper. He said, listen, you're not that big that I can't take you over my knee. Every time, it's a funny, when I think of dementia, I often think of that particular story. I'll tell you one other quick story. I was out in one of our homes here last week, and I was talking to a lady, and she's 92 years of age. And she said to me, I was talking to her about her life, etc., etc. And I asked her, I said, how old are you? And she says, I'm 92 years of age. She said, how old are you?
How old?
So I told her. And she said, and I love it, I'm going to tell this story every day I have an opportunity to talk. She says, oh, you're just a young pup. So I couldn't, anyway, there's two of my favorite stories.
72.
Yes.
Not
72.
a day old.
Anyway, there's really not much sense of me talking to you about dementia care because obviously you had Sultan Darvish over here, and I know Dr. Darvish, and I expect that he gave you probably a pretty good overview, and with Dr. Stoltz here, and if I'd known Tim wasn't going to wear a tie, I wouldn't have worn one either, but I expected him to come dressed in his best suit. And, no, he never wears one, so. Anyway, I thought what I'd do is I would share with you a bit of an overview of the long-term care system and the home care system on Prince Edward Island, and hopefully that will stimulate for you some questions that you may want to follow up later. Prince Edward Island's long-term care sector has about 1,095 beds in it. We have 18 nursing homes, 9 in the private sector, and 9 in the public sector, 9 in the private sector, 9 in the public sector. Public sector has about 595 beds, and the private sector has about 500 beds. We just finished a major $65 million manor replacement program on PEI, and we have replaced four of the five nursing homes that were planned to be replaced, and the most recent being Prince Edward Home that just opened this past fall. And I want to talk to you just briefly about the Prince Edward Home because it's the model of all of these facilities was really based on trying to create an environment that was respectful to our seniors. And that, from where I stand, means private rooms and private bathrooms. To me, that is the basic elements that you demonstrate around issues of respect. And I appreciate that we have a lot of places in the province that are older and they're not in that particular position, but I would expect the trend now going forward for the building of nursing homes is private bedrooms. The other thing we wanted to do was to have small neighborhoods or small units. We have 10 or 12, I think the maximum we have is 14 on a particular neighborhood. And we did that specifically because of wanting to create an environment that was really conducive to good quality of life for those that have dementia. You know, the traditional nursing home environment with very large nursing units creates a tremendous amount of stimulation. And that stimulation often triggers a lot of behaviors that create an unpleasant circumstance for the individual and certainly some challenges for the staff. We also introduced a collaborative model of care within the long-term care facilities, and that essentially meant the expanding of the scope of practice for LPNs, increased utilization of resident care workers, and we reassigned some responsibilities to our registered nurses. The average nursing home resident, the average age of an individual going into one of our nursing homes is 82 years of age. Now think about that, back in 1900 the average life expectancy was 51. 82 years of age, and the average length of stay in one of our facilities is 2.7 years. We have in all of our systems, we have focused a lot of energy over the last 5 years, particularly to really emphasize and educate our staff about adopting what we call, and everybody's calling now, a person-centered approach. You know, that is how you respect the individual. You engage the individual to continue to make the decisions in their life that they're capable of making, and to take as much control and responsibility for themselves as they possibly can. In other words, what we try and do is to maximize their potential. People know me, listen, I can talk for a long time. How long was I supposed to have?
I think it's done now.
On page 2. So I'll try and move along here. I forgot I was on a clock. And my staff know my staff who work for me have the tap going. They know how long I'm supposed to talk, and they'll all start tapping their watch. Anyway, I'll just move along here a little quickie. We know in Prince Edward Island, 8% of the population of Prince Edward Island is 75 years of age or over. That doesn't sound like an awful lot, but when you begin to convert that to numbers, that's 10,800 people living on PEI that are 75 plus. Admissions to long-term care, I don't think I need to go into that in a whole lot of detail. We do have a senior screening tool that's used to evaluate. There are 5 levels. Levels up to 3 are typically community care facilities. Level 4s and 5s go into our deemed nursing care or long-term care. Home care staff, we have, let's see, we have 5 home care offices in the province. We have 168 staff. Last year we served about 5,000 people, and the average monthly caseload in home care is about 2,500 people. I'm just skipping through some of this stuff now because I know I'm taking too much time. I was fortunate enough to have the opportunity to chair a committee to develop a provincial strategy on dementia care. And that was I not supposed to talk about that, or should I talk about it?
We haven't seen it released yet.
No, we haven't. I know you haven't. And Trent's quite right. It hasn't been released yet. But I don't mind making a couple of comments because we have submitted it for, hopefully for funding or for consideration for funding for the 14-15 fiscal year. Because we really do. We need a dementia care strategy in Prince Edward Island. We need a caregiver strategy in Prince Edward Island.
2014-15.
Usually my messages don't draw much applause, so thank you for that. But the strategy does address issues that I'm sure you've already talked about. The importance of early diagnosis and treatment, critical in any disease. But this one in particular. Enhancing quality of life and support for people that are living with dementia, enhancing the quality of care and support for caregivers, access to a coordinated continuum of support and service, enhancing the quality of life, leadership, education, and training for our staff. As I understand it, there are about 2,000 citizens of Prince Edward Island that are currently living with dementia, and that number is expected to double over the next 20 years. So you can appreciate it. Now is the time to start getting it right. So planning for the future, the reason I believe that we're in this continuous turmoil over the expenditures that we spend in healthcare is because we don't plan far enough into the future, because we have all the data, all the research, and all the information to plan. We just need to take that information and take a much more longitudinal approach to how that planning needs to occur. I'll make one last final comment, and then if you have questions, I got to page 5, by the way. But dementia residents or individuals that have dementia do pose the biggest challenge for us in terms of placement in long-term care. They do. We have a dementia unit on Beach Grove Home, we have one at Prince Edward Home, and there's one at the Atlantic Baptist Home. And these are the individuals that, for the most part, spend lengthy periods of time in hospital. We have right now on PEI about 142 people waiting for long-term care. The average length of stay, or the average wait to get into a bed is 41 days. And as soon as I say that, somebody says, I know somebody who's been waiting for a bed for months. And typically the individual that you would be referring to is probably somebody that has dementia care. Well, the news is good there, because very soon, through this last series of RFPs, we designated a very high number of those beds that are coming into the system to be designated as beds for dementia care. So we will have 30 beds that are designated for dementia care that will be opening up probably by the 1st of April. So So that will help to deal with that particular problem and address the fact that we don't have enough beds, because the last place we want people with dementia languishing is in an environment that is so extraordinarily stimulating that it just continues to perpetuate or exacerbate the disease itself. I said that was the last thing, but there's just one other quick thing, and I'll.
Hand on the.
It's only one quick thing. I hate to give this thing up. No, that's not it at all. You know, the Council of Federation of Premiers spoke about the importance of dementia in the summer of their 2013 meetings, and I'm going to quote for you what they said about it. As our population ages, it is increasingly becoming an area of concern for provinces and territories. Premiers are determined to increase awareness, address the challenges, and provide opportunities to improve early diagnosis and treatment. Premiers directed the Healthcare Innovation Working Group to examine issues related to dementia, including identifying best practices for early diagnosis. Central to this is raising awareness of early warning signs and the various methods of intervention. So I think the message is beginning to get through, but there's a lot of work that needs to be done, and when we gather like this, we can continue to put the pressure on so that necessary research and work and planning will begin to identify and deal with the problems of this particular population. Thank you very much.